The glenohumeral joint articulates with the head of the humerus and the glenoid cavity of the scapula. The joint capsule is a joint support structure of the glenohumeral joint. It is a fibrous sheath which encloses the structures of the joint. The glenoid labrum is another joint support structure, and it is a fibrocartilage rim within the glenoid fossa. The ligaments of the glenohumeral joint include the coracoacromial, coracohumeral, and the glenohumeral ligaments. Associated bursa of the glenohumeral joint includes the subacromial bursa, subscapular bursa, and the subcoracoid bursa. The subacromial bursa reduces friction beneath the deltoid and thereby promotes free motion of the rotator cuff tendons. The subscapular bursa reduces wear and tear on the tendons during movement at the shoulder joint. The subcoracoid bursa reduces friction between the coracobrachialis, subscapularis, and short head of the biceps tendon. Movements of the glenohumeral joint include medial and lateral rotation, flexion and extension, and AB and adduction. The acromioclavicular joint articulates with the acromial end of the clavicle and the acromion of the scapula. The AC joint support structures include the AC joint capsule, AC ligament, and the coracoclavicular ligament. The joint capsule consists of loose fibrous layer which encloses the two articular surfaces. Its posterior aspect is reinforced by fibers from the trapezius muscle. The AC ligament covers the joint capsule and reinforces its superior aspect. The coracoclavicular ligament consists of the conoid and trapezoid ligaments. These ligaments suspend the weight of the upper limb from the clavicle. The AC joint allows for axial rotation, axial elevation and depression, and axial protraction and retraction. As no muscles act directly on the joint, all movement is passive and is initiated by movements at other joints. The clavicle and sternum are joined at the sternoclavicular joint. The joint support structures include the joint capsule as well as several ligaments. The joint capsule consists of a fibrous outer layer and inner synovial membrane. The sternoclavicular ligaments strengthen the joint capsule anteriorly and posteriorly. The costoclavicular ligaments act as a main stabilizing force for the joint, resisting elevation of the pectoral girdle. The interclavicular ligament reinforces the joint capsule superior. Movements of the SC joint include elevation and depression, retraction and protraction, and posterior rotation.